Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center in New York City. What are anterior mediastinal masses, and how do we evaluate them with imaging? The normal thymus evolves over the course of a lifetime with involution and gradual fatty replacement beginning around puberty. The thymus originates from 3 embryonic germ cell layers and therefore has the potential to transform along a number of neoplastic cell lines. On CT, the normal thymus appears as a triangular shaped structure in the anterior mediastinum. Variations in the morphology of the normal thymus, along with its association with a diverse range of pathologic processes, can make the thymus an imaging enigma and diagnostic challenge for many clinicians. An abnormal appearance of the thymus can be attributed to either diffuse enlargement of the gland or a discrete mass. Benign thymic hyperplasia and lymphoma can both cause enlargement of the thymus. As I mentioned, generally it involutes, and in adults, we may not even see any thymic tissue, but in patients undergoing treatment for cancer, they may develop thymic rebound hyperplasia, which is enlargement of the thymic gland. And that could also pose a diagnostic dilemma as to differentiating it from other lesions of the thymus. Many lesions, including thymoma, thymic carcinoma, and thymic carcinoids, as well as benign lesions such as thymolipomas and cysts, can present with a focal thymic mass. And this is often an incidental finding in an asymptomatic patient undergoing imaging for unrelated reasons. Currently, CT remains the imaging modality of choice for the evaluation of mediastinal masses, with MRI and PET-CT as useful adjuncts. Although there is some overlap in the features of many thymic lesions on imaging, some lesions do have characteristic appearances on CT. For example, a thymolipoma, which is an uncommon benign thymic neoplasm, may present as an anterior mediastinal mass containing fat, or cystic lesions can be benign or malignant. And the increased use of CT has led to this frequent identification of incidental lesions in the anterior mediastinum. With recent advances in minimally invasive surgical techniques, an increasing number of thymic lesions are referred for surgical evaluation. Consequently, some patients may undergo procedures for ultimately benign disease. If the benignity of a thymic lesion could be determined on imaging with a reasonable level of confidence, then the need for invasive procedures may potentially be obviated for a number of cases. And we've published on imaging features that may help distinguish benign thymic lesions from early stage malignant neoplasms. And I'll share that image with you. This was a paper we published in the Journal of Thoracic Oncology, distinguishing benign thymic lesions from early stage thymic malignancies on CT. And as you could see, some of these images show you this would be the classic typical appearance of normal thymic tissue, this triangular appearance. This patient had a cystic lesion, which was a lymphangioma. And you see a simple cyst, but the characteristics do overlap. This was a patient who had intralesional fat in pathologically confirmed thymic hyperplasia. But because the appearances do overlap with other tumors, it may not be clear-cut and may end up needing pathologic confirmation. This was a rare case of an anterior mediastinal mass that contained fat within it, which was a thymolipoma, but was resected. And in this patient, you see that there's an anterior mediastinal mass which invaded into the adjacent fat. Now, what we concluded is that features can be helpful in determining a benign etiology for some thymic masses. And for example, intralesional fat, mediastinal location, and this triangular thymic shape are more frequently found in benign thymic tissues. thymic lesions, and infiltration of the mediastinal fat, particularly in the setting of an older patient or a large mass, may increase the likelihood of a malignant lesion. But there are overlaps, and it's not completely clear-cut even on imaging.